everyone, this is Megtoes Super, and in this video, I am going to talk about men's health issues. So let's begin. Men suffer a lot of various diseases, and are main victims of cancer, diabetes, prostate cancer, cardiovascular diseases, influenza, pneumonia, respiratory disease, HPV, etc. However, all of our issues are being neglected just because we are men. Society teaches males "Fati, boys don't cry, be a man," etc., which is worsening the situation. Society tells men not to show pain. This has affected men so much that 46% of men hesitate to talk about their health problem. 49% of men are more depressed than they admit. Moreover, men themselves are less likely to go to checkups than women. Men always worry about their wives and children, but themselves don't care about their health issues. Moreover, there is governmental discrimination against men. All countries fund heavily for women's health, but men's health get very little funding. This is complete sexism against men. Prostate cancer has become a common form of disease, but government is silent. A latest data shows that more men now die of prostate cancer than women of breast cancer. However, breast cancer receives far more funding than prostate cancer. Some people say that breast cancer receives 15 times more funding than prostate cancer. Let's talk about coronavirus. More men are also dying because of coronavirus. But men aren't receiving any funding from government. If more women died of coronavirus, then there would be women COVID funding, reserved ventilators, hospitals and beds. People blame men for higher smoking for corona deaths. But in China, roughly 20% women smoke, then compared to 50% men. But in Italy, roughly 40% of women smoke compared to 47% men. So there should be equality, but in Italy 70% of corona deaths are men. So smoking isn't responsible for male coronavirus deaths. Now moving back to topic. If you want to know more about prostate cancer and its symptoms, then you can pause this video and read. Men also have higher suicide rates but is ignored by everyone. Family pressure, marital disputes, fake rape cases and joblessness, poverty, are main reasons for male suicides. Also, married men are twice more likely to commit suicide than women. WHO is also sexist and misandrist. It asks countries to suspend vaccines of HPV to boys. HPV is human papillomavirus. Seriously? Just because we are men, we would not be given vaccines. During food shortage in Haiti, in 2010, who gave food to only women and girls? And men were denied food. It isn't matriarchal or misandrist. But it would be considered misogyny and patriarchy if females were denied food. During any emergency situation, lives of women are given priority than men's lives. See Titanic. Because of all of these sexism and misandry and gynocentric thinking, there are now young men are now more likely to suffer from mental health diseases, depression and bipolar diseases than women. If society would have cared about men a little bit, we won't be suffering this much. To cure depression, men at last drink alcohol, which in return harms men more. Now let's focus on how to improve men's health. See, the society doesn't care about us as a man. We have to look on our own health. So, visit a doctor every 6 months and do medical checkups. Do yoga, go to gym and walk to keep you healthy. Avoid eating junk food and always eat veggies and healthy food. Avoid junk food. This will also help you to avoid diabetes, which affects mostly men, middle-aged men. Focus on hygiene and bath regularly. If you feel any kind of symptoms of any disease, don't ignore it and visit a doctor as quickly as possible. Stop drinking and smoking completely. Most men suffer respiratory disorders due to Smoking. So avoid smoking. Heart attack is the biggest killer of American men. Avoid refined flour, oily food and butter. Tobacco is the biggest killer of Indian men. Men have lower life expectancy than women, but it also depends on individuality. If you stay fit, you may live 100 years. Thank you.